Hi everyone. So this is a follow-up to my first exercise I did in the video, which is called the chin tuck. Now I'm going to teach you guys how to do a good isometric stabilization exercises for your neck. There are many situations where when you have a neck problem where you're not allowed to move your neck and do your exercise, rather keep your neck stable and still strengthen all the muscles around your neck. So that's why they're called isometric, which just means no movement but improved strength in your neck. Okay. Now to do this exercise the right way, it's very important that you have practiced those chin tuck exercises the right way. One more time, that exercise which I did in my previous video was keeping your hand and pulling your chin backwards and then holding it in position. So this is the position where you should start with. Okay. Now once you got your chin tuck exercise position, that's where you'll start to do the isometric strengthening exercise. Now remember, when you do this exercise, the amount of force you're going to give for to strength should what we call as a submaximal, which is probably close to a 50% force you'll have to generate using your own hands. All right. So what I'm going to do is I'm going to show you the first one. Now there are different movements of your neck where you can move your neck forwards, you can move your neck backwards, or you can turn to the right, or you can turn to the left, or you can tilt to the right and tilt to the left. Now what we're trying to do is we are not going to do any of these movements, rather stop these movements from happening by using my hand as a force to stop the movements. In that way the muscles will go tight and they can actually build some strength while your neck is healing from the injury. It could be any injuries, from an acute injury to people who have disc related problems or nerve root impingement, anywhere where a movement will cause pain, but you can still do these exercises to increase strength. All right, so let's go straight into the exercise. Okay, what I'm going to do first is do my chin tuck. So I'm going to slightly take it back. So once I'm in this position, what I'm going to do is I'm just going to use my finger very gently here, and I'm going to bring my head forwards, but the fingers will stop the movement from happening. Watch carefully. So I'm going to push now. Now you notice you probably did not see any movement, but I'm pushing my head into my finger. I'm just holding it for 5 seconds and I'm slowly letting go. So the head did not move at all. A lot of people, when they do this exercise, what they do is they put the hand and then they push the head forward. You see, when you see a movement, that's not the right way, right? You should not have any movement, but push the head against the finger, or you can use your hand this way, but do it in front of a mirror. So you know if you're doing any movement, you're doing it the wrong way. One more time, watch carefully. I'm going to take my head back. And once in position, I'm going to put my finger and I'm going to gently push my hand into my finger, and I'm going to count up to 5 seconds and I'm going to release. In the same position, or you can relax and come back, and this time my hand goes at the back. Now I'm going to push my head backwards. Watch carefully. There will be zero movement. There we go. I'm pushing it now. I'm holding for 10 seconds or 5 seconds. Remember, you're not supposed to speak when you do this, but you rather count and slowly let go. So this was preventing the movement from going backwards. Now here we go. So there's another movement you can try to prevent is rotation. So for that, once again, get to the chin tuck position. Put your hand on the side. Stop this movement from going sideways. And I'm going to push now. You notice there was no movement on my neck, but I'm pushing my head into my hand. Hold for 5 seconds and slowly let go. And repeat on this side. And I'm going to try to turn my head to the left. I'm pushing it. You might have seen my arm move, but my neck didn't move. And I'm going to hold it for 5 seconds and I'm going to let go. Okay. There's 2 more movements you can stop. You remember the tilting movements? So that can also be worked. Okay. For that, what I'll do, I'm going to keep my hand on the side on the top here. And whenever I'm ready. So once again, don't forget this. I almost forgot this. So I'm going to take it back and I'm going to keep here and I'm going to gently push this thing. I'm trying to tilt. You notice there was no movement on my neck. Hold it for 5 seconds and let go. Keep my hands on the left. Again, give lots of breaks in between. Go back to chin tuck and then push and hold for 5 seconds and let go. The amount of force you give should be very, very less, and you slowly, gradually increase. If you're working with any physio, remember, they would put the hand to see how much of force you can give, and then they would tell you to stop at one point, right? So if you're not sure, work with the physio and make sure you do this the right way, and then you can put your own hand sideways, forwards, backwards, and you can give your own force. Don't put too much resistance on your hand, because sometimes it can aggravate your pain in your neck. Sounds good? Once again, when you're doing this exercise, if you notice any movement of your neck, you're doing it the wrong way. When you're pushing on your hand, your head should not move at all. That's why it's more preferable to do this exercise in front of a mirror, possibly seated with a chair with no armrest. All right. So once again, this exercise is known as the isometric stabilization exercise for your cervical or your neck region to increase strength in your neck without moving your neck by applying force in your hand. All right. See you guys later.